Welcome to MedmatchMD Spotlight, where I highlight amazing Caribbean medical schools, alumni, and students. There is an enormous amount of misinformation online, so I have created MedmatchMD, a one-stop platform that helps pre-med students narrow down the decision of applying to Offshore Caribbean Medical schools by instantly comparing close to 40 schools with multiple requirements side by side. I am Dr. Ola Kolawole, board-certified family practice physician, Caribbean Medical School graduate, and founder of MedmatchMD, where I help pre-meds and non-traditional pre-meds just like you make an educated decision of choosing the right medical school so you can fulfill your dream of becoming practicing physicians in the United States or Canada. So, let's get started. I am your host, Dr. Ola, and this is MedmatchMD Spotlight. Hello, everyone. This is Dr. Ola Kolawole. I'm the founder of MedmatchMD, and today I have with me Dr. Leenah Chughtai. Dr. Leenah is a resident in internal medicine, and she is here today to talk to me about her journey attending a Caribbean medical school and her journey into matching into residency as well. So without much further ado, I have today with me Dr. Leenah Chughtai.
Thank you.
Thank you for coming aboard and to talk to about your experience.
Sure.
Going to a Caribbean medical school. So for starters, I'm going to ask you to tell me a little bit about yourself.
Sure. Okay. So I grew up around Toronto. I knew that I've always wanted to be a physician. There was absolutely nothing else in the world that I ever wanted to do. And it's very competitive and it's very daunting and scary to try to apply to medicine in Canada. And so when it kind of looked like it wasn't really going to work out, I discovered that there are Caribbean medical schools that offer opportunities to people from all walks of life. And that's where I began my journey to finally becoming a physician.
Awesome. Awesome. So what Caribbean medical school did you attend?
I went to Saba University School of Medicine.
Okay. And just for, for my listeners who might be wondering where Saba is, could you tell us a little bit more about where it's located?
Sure. Yeah, so it's actually on the island of Saba, which is right next to St. Martin. Teeny tiny island. Not a lot of people have heard of it.
Yeah. But, the school, a lot of Canadians actually tend to go to Saba. Am I right to say that?
You're absolutely correct. Most of my peers at Saba are Canadian, yeah.
Okay, awesome. Okay. So now I know you talked about why you decided to go to Saba. And, being a student there, what was your experience like going to that, being a student at Saba University?
Sure. So, I can look at that from a few different perspectives. So I can look at that from the aspect of being sort of on an island in the Caribbean itself. I can look at that from the aspect of the school itself, and then from the peers with which I attended the school with. So, first of all, being in the Caribbean, it's a very different environment from being, in the States or in Canada. And I don't mean that just because you're physically in the Caribbean. I mean that because you're kind of going off to a different part of the world solely for the purpose of, achieving your dream, trying to attain your career. So, my personal experience was fantastic. I know for a lot of people, it's overwhelming or it's a little scary because it's something that they've never done before or they've never done anything quite like it before. For me, it was fantastic just because it was attached to, my dream. So anything I was doing towards achieving that step was exciting for me. Then in terms of sort of the perspective of, how was the school? It was great. They tried to do everything they could to help you achieve your goals. Whatever input you have, it was welcomed, whatever input you wanted to give them to better the school, the curriculum, whatever it was that you wanted to talk about, that was always welcomed. And then the other thing is because it's a Caribbean school, I felt like anytime afterwards I met anybody from any Caribbean school, we always had a sort of connection where I was like, yep, I know what you went through. We went to a similar school in a similar part of the world. So that was always fantastic to me. I still keep in touch with so many people from my school just because we went through something very unique together.
Yes.
Yeah.
And you're so right in saying that, because so I went to Ross University and I graduated in 2007. Mm-hmm. So I was at Ross back in 2000, well, because I took a year off in between. So I started 2002. And can you imagine, I'm still in contact with a lot of, other docs that were in my class at that time, back in 2002. I remember I got married while I was in Ross, and about 10 of my classmates came to my wedding. So, the bond was just so strong because we're all doing, like you said, something really unique together. Mm-hmm. And mm-hmm. so you're so right. And even when you meet other Caribbean medical grads, you totally understand what they've been through. And
definitely.
And the success is always sweet, just, being able to have graduated and gotten into residency. And so that's going to be my next question for you. So tell us about the process for you matching into your residency program. As a Caribbean medical student, was it a difficult process for you? And the mere fact that you matched in the same year you graduated, that's phenomenal. So tell us a little bit more about your experience.
Sure. Yeah. So first thing, before my sort of journey to match, because I was in last year's match cycle, I started, the application, everything last year for the 2020 match cycle. So it kind of begins though, at the beginning of medical school. So I didn't have any kind of resource for me to speak to Caribbean medical grads or somebody who was currently in a Caribbean medical school. So I went into medical school being very scared about, do people actually match? Is this for real? Is this really going to work out? Now, of course, the school's statistics and their match rates and everything are all up online on their website, but I still, because it was, you're going into the unknown, I was very scared about it. I didn't know if these were everything, all the statistics on their website were actually true or not. Yeah. And I personally didn't know anybody who'd gone to medical school. So, and I know a lot of people did, but a lot of people didn't. Yeah. And so it would have been really nice to have some sort of resource to, to tell me about what it was going to be like, or to reassure me, or to sort of tell me the honest truth. But anyway, so when I went into, my match applications and my exams and everything last year, I was sort of feeling a little bit doubtful just because I still didn't quite know if the outcome would be what I wanted it to be. But one of the good things is that, once you're in the school, of course, you get to know people, then you know people who have just graduated, just sort of ahead of you. And so they can help you. And just like I said before, there's a sort of unique camaraderie between you and your peers in medical school. So everyone is always really willing to help out. And then my school itself also offered resources. They had a whole match handbook, step-by-step guide for both the NRMP match and the Canadian match as well, just because there were so many Canadians in our school. So they knew that a lot of us would be wanting to, pursue going back home. So although it was extremely daunting at first, it became easier the more I figured that there are actually resources available for me in the form of my peers and my school. But, it was a little bit of a tricky situation, especially when I went into my exams. So I had never felt separated from American medical students during any of my rotations. We had fantastic opportunities, to rotate at all sorts of fantastic places, but I felt it when I went to do my Step 2 CS exam, because there was not a single Caribbean medical school, medical student there. There was not a single international medical student there. They were all American medical graduates, and no one wanted to talk to me. and you're already so stressed. It's the day of your exam, you're scared. But I was like, okay, no, I'm here to do my exam. It's okay. But that was sort of the first time, and actually the only time, that I felt like, is it a bad thing to be a Caribbean medical graduate?
Well, you know what? You made it that far. So hey, no. I mean,
no, it's not at all a bad thing. But in that moment, you're stressed out. You're like, this is strange. There's nobody here I can relate to. When in fact I can relate to all of them. We were all medical students. We were all doing our CS.
Yeah.
But anyway, yeah. So then when application time rolled around, I actually found there were a lot of resources to help build my application, to help me put together things, to help me even understand the little technicalities of going on like the ERS website and things like that. And I was doing my rotations throughout that entire time.
Okay.
So, when it came time to start hearing back from places about your interviews, I wasn't getting many. Actually, for the first month, I didn't get any, and I was terrified. I was reviewing my application over and over again for red flags. I had already, showed other people my application before I had submitted it, but I was re-showing it to people. Is there something that somebody missed? And the fantastic thing was that my school was willing to go through our applications with us before we submitted them, and making sure that there was nothing that stood out. There was no mistake that we'd made, but there was nothing that anybody could find at all. And then suddenly, the interview offers came. So I just had to wait a little bit. I just had to be patient. But I interviewed all the way up until February, and oh my gosh, the interview trail.
How many interviews did you go for?
So I actually didn't go for all of my interviews, just because there were conflicts with some of them, and then some of them were in places that I thought, yes, I applied there, but I don't really want to geographically end up there. So I actually only ended up going to 12 interviews.
Okay. Yeah. Very good.
I heard a lot of people got so many interviews, and so I kept thinking, is that okay? Well, it's fine because you only need one to match it. So
exactly. Yeah.
It's absolutely fine.
Yeah. So
yeah.
Sorry for interrupting. I think you wanted to say some more, or
I just wanted to say, the interview trail. On the interview trail itself, I met 80% of the interviewees I met were Caribbean medical graduates. Yeah. And that was just amazing for me,
Yeah. Now, did you pick IMG friendly schools? And now, for the benefit of my listeners, IMG is International Medical Graduate. And so there is some residencies, I said schools, but I meant residencies, but there are some residencies that will accept, or at least be open to accepting, international medical graduates. So for that reason, it's always recommended that if you're a graduate of a Caribbean medical school or any other international school, that you apply to these residencies, amongst others. So I guess that was my question to you. Did you?
I applied mainly to IMG friendly residencies. So, before sort of applying, I compiled a big list of, first of all, narrowing it down to geographical location, and then narrowing it down to exactly the program based on what sort of visas they take. So, are they IMG friendly or not? And kind of what percentage of their residents are IMGs, and then even into that, what percentage of them are Caribbean medical graduates. So that was definitely a big factor. I did apply to some places that, it didn't look like they took a lot of IMGs or Caribbean medical grads, but they were willing to take the visa that I would be on. Okay. So, but mostly for sure, you kind of have to do it in a smart manner. Definitely applied to mainly IMG friendly residency programs.
Sure. So when you were applying to medical school originally, did you do a whole lot of research before choosing Saba specifically? And why Saba? Why not any other? Why did you decide to go specifically to Saba?
Sure, yeah. So I think me applying to medical schools in the Caribbean was, first of all, done on a little bit of a whim. Okay. because I didn't have a whole lot of knowledge about Caribbean medical schools. I had only recently, before applying to them, even learned that they existed,
Okay.
that they were a thing. And I didn't do a whole lot of research because the big three that I had heard of were St. George's, Ross, and Saba.
Yeah.
And only very recently I'm learning of so many other schools in the Caribbean. Yeah, there was no real resource for me, like a centralized resource for me to have that sort of information at my fingertips.
Right.
There were, I was researching things online, and like you said earlier, a lot of those tips were negatives. A lot of those things were telling people to stay away from Caribbean medical schools. And they were mostly on like forums.
Right.
People just sort of expressing their opinions. There was no like list of all the possible medical schools in the Caribbean, or what tuition is like at each of these, what their match rates are. There was no sort of centralized resource for that. And I really wish that I had found something like that, or that there had been something like that when I was looking, because that would have been extremely helpful. So really the only reason I ended up choosing Saba was purely based on tuition fees from the schools. Yeah, that's really the only main reason I chose it.
Okay. So you looked at the top three and you thought, well, you know what, this is decent compared to others. Okay.
Yeah.
That makes sense. That makes sense. And that's, that's the whole premise to MedmatchMD, to create, sort of a platform, where students can just come to and get all the information they need. And as opposed to, yes, we hear of the top three. In fact, there's top four, and, sometimes Google hard enough to find top six. But the whole point is, get all the information you need, and then you make that decision for yourself of whichever one you want to attend. So, but I'm glad you ended up picking Saba, and it worked for you. You're a resident now. So give me just briefly, and just, I don't know, like a couple of a minute or two, what a day in the life of a IM resident looks like, at least your life now.
So that's very limited experience, mind you, a month and a half, almost 2 months now, actually.
Okay, that's good enough.
So practically a day in the life of an IM resident is, waking up early, as early as you can think.
I remember those days.
Must be nice not to have those days anymore.
Hey, there's a light. There's definitely a light at the end of the tunnel. I mean, you're definitely closer, than
yes, that's true.
Yeah, have been in the whole journey. So go ahead.
Yeah, waking up as early as you can think of, getting to work and being very, very focused on what you have to do for the day, and juggling what you have to do on whatever rotation you're on with the didactics that you have during the day. And always remembering that you are here for training. Yes, you're a physician, but you're here for training. So almost your entire day is made up of learning, whether it's clinical or whether it's, in a conference room. And then honestly, going home at the end of the day feeling pretty satisfied that, that you're doing what you wanted to do. Yeah.
Awesome. So is it, so there's that misconception, first of all, that if you attend a Caribbean medical school, you won't match, or if you do match, you end up matching into just family practice. In your case, you matched into internal medicine. How competitive is it to match into internal medicine? And what advice would you have for premeds that feel, they'll be limited in terms of specialties, or they'll be limited in terms of getting into residency? What kind of advice would you have for them?
Sure. So first of all, just about, getting into residency or like that, the preconception that you won't even match, that is obviously not true. Yes, it is very competitive for I mean, for any specialty that you're going to be applying to, it's going to be competitive just because there are so many people applying for it. But you have to take a look at what sort of applicant you are, what's on your application, what are your scores like, what are your strengths, and apply intelligently, towards whatever specialty or field you're looking towards. Take a look at the scores that programs have as their cutoffs. Be smart about it, make informed decisions. It's great to want to do something, but sort of start early working on that something. If you already know, and you don't have to know as a pre-med what specialty you want to go into, but if you have an idea of what you want to go into, then maybe start looking into what kind of step scores a lot of programs have as their minimum, and try to work towards that first before even worrying about whether matching or not, because that's going to be a part of matching.
Yeah.
But whatever it is, whatever specialty you want to go to, I think as a pre-med, don't really worry about things being competitive. Don't worry, but think about making the most informed decisions that you can. As a pre-med, I think your biggest worry should be, let's get me into medical school. And making an informed decision to getting into medical school, and thinking, it's great to think ahead. It's fantastic to think ahead. But I think thinking too far ahead can be a bit of some people's downfalls, just because then you get tunnel vision.
Yeah.
And I think it's the best to sort of have a rough idea of what you want to do and hold that idea, but take a step back and look at the bigger picture. Let's try to get you into medical school first, then let's try to get you to match.
Right.
Yeah.
Let's have you graduate from medical school.
Yeah. Yes. Yeah.
Yeah. Right. And like you rightfully said, it's okay to think in advance and to plan in advance, but then don't overthink it. And that is where having the facts, like knowing what the match rate is, with each school beforehand, before applying to that school, knowing what type of rotations they have. Are there rotations in, teaching hospitals or not? In terms of the experience you'll get while doing your rotations, that's helpful, because again, the more, if you do your rotations in a teaching hospital, you're exposed to so many, docs, and you're exposed to residents, and you can prove yourself even while you're on those rotations. That's another thing I tell students about. When you're in a rotation, don't just see it as, I just want to get it done. You need to work harder than your fellow American, medical student. I hate to say that, but you do, as an international medical graduate, you kind of do, to prove yourself. And so when you work really hard during that rotation, you make an impression, even on the residents or on the program director or who have you. And then you can also get letters of recommendation if you don't end up going to that residency program. Would you agree with me?
Yeah. I do absolutely agree with you. So, you do have to work. You have to work hard, because for one thing, a lot of people do have that notion that, international medical graduates or Caribbean medical graduates just aren't as good as their American counterparts. So you do have to work hard, and you have to show that you're working hard. And like you said, a big part of it is you're going to be able to get letters if you're a strong student during those rotations, and that will obviously go towards your application for matching.
Yes. Awesome. So, with the United States Medical Licensure Exam Step 1, they changed it from the score, the scoring system to just pass fail. I've had one or two students or pre-meds ask me, if I think that will affect Caribbean medical graduates or international medical graduates in getting into residency. Personally, my thought was it shouldn't. There's always, 22 to 25% of docs in the United States are international medical graduates, for one. So there will always be that need, number one. And number two, even if it's a pass fail and they don't have a real way of measuring how well a student or a graduate has performed, they have other ways of evaluating a person's performance. There's step two. So I'd like to know if you agree or if you have any other thoughts about that.
I actually completely agree, because your step one score, first of all, is only one part of your application. I know there's a lot of focus on our scores, on our grades, on sort of the numbered part of our applications, but although it's an important part of it, it's only one part of it.
Right.
You have your step two, and then you have so many other things. If you have strong letters, if you just have a strong overall application, if you sort of did well in your, at school, you have a good dean's letter. I think most places like scores are sort of used as a cutoff, and now because it's pass or fail, it's really, that's different now. So if your overall application is strong, it really shouldn't make a big difference for international medical graduates or Caribbean medical graduates. Yeah, I think I completely agree with you.
Awesome. So there are some medical students or pre-meds in Canada that are trying to make a decision. As a matter of fact, I spoke to one about a week and a half ago, and they want to return to Canada. Mm-hmm. So was there any reason why you chose to apply for residency in the States as opposed to Canada? And other question would be, do you think is it worth it even trying to go through the residency application in Canada?
Yeah, so I actually did apply to the Canadian match. I applied to both the American and Canadian match, and I just happened to match in the States, and so that was perfectly acceptable to me. But see, that was my personal opinion, where I felt, I can match in Canada, I can match in the United States, I will equally, I'll be equally happy. Sure, matching in Canada will mean, because I'm a Canadian citizen, I won't have sort of visa things to deal with, but I would personally be happy matching in either place. So I think for people who are thinking about going back to Canada, it is very much possible. There are so many Canadians in so many Caribbean medical schools. And a lot of my peers have matched back home in Canada. So I really don't think that it should be a problem, especially because there are so many people, there are a lot of resources to help you with your applications in Canada, with your exams in Canada. So, if that's something that someone is worried about, I would say, maybe, especially as a pre-med, one of the biggest things I would suggest is all the schools that you're thinking of applying to, if you can't find those sort of things on their website, email them and ask them all the questions you have. They are absolutely fine with you asking them questions. So sorry, that was my alarm. They're absolutely fine with you asking them questions. In fact, it's good for them because they're sort of getting, exposure out of it. So don't be afraid to ask. Make the most informed decision you can, especially if you're really thinking of matching back in Canada or going back home.
Awesome. Yeah. Awesome. So you've been really, really informative, and I thank you so much for taking the time to answer all these questions. I would like you to answer one last question for me, and that would be, well, it's not really more of a question, it's just more of a advice that you'll give students. And so these are unprecedented times, with the COVID pandemic. So a lot of students or pre-meds who initially wanted to become doctors, they're second guessing whether or not they even want to become doctors, let alone go to the Caribbean for medical school. So what would you say to that student, that pre-med who's always wanted to become a doctor? All of a sudden now we're here with COVID, and then they're not even sure about, going to the Caribbean. What would you say to them?
Yeah, so first of all, their fears are very much founded. I understand where they're coming from, but if it is something that you have always wanted to do, what exactly is it about COVID that is scaring you from achieving your lifelong dream? You know, it's a short-term fear. In the long run, do you still want to be a physician?
Yes.
You know? And currently there are physicians, there are healthcare workers, there are all kinds of people. We're working with coronavirus, you know, where like it's, and I'm not going to say it's fine, it's not necessarily fine, but the point is pandemics are a part of our profession.
Yes. If it's not COVID, it'll be something else at some point.
Exactly. That is what we are here for, you know? So maybe for those people who are, you know, sort of doubting their decisions, their career paths, think about why it's scaring you. You know, does it mean that you don't want to be a physician altogether, or are you just sort of scared in the short term, which is completely understandable. It is scary. You know, nothing like this has sort of really ever happened in the past, in the West at least. So just really think hard about what it is that's scaring you, and really think that, you know, pandemics, epidemics, these are a part of our profession. They will always be a part of our career, especially epidemics. Like this is what we do. It will always be scary, but we have chosen a profession to help people who are going through these kinds of things.
So, and for those that are concerned about going to the Caribbean, I mean, I know I've made some videos, I actually made a video just recently talking about, you know, the Caribbean at this time. And one thing is, a lot of these schools are offering online you know, instruction during the COVID pandemic, especially with the basic medical sciences, you know, if you're going to the island, if you're supposed to go to the island. So a lot of these schools, in fact, I think virtually all of them, you know, I can't speak for all, but I know a handful of schools are offering online instruction. So so that's an option. You can study from the comfort of your home until it's safe to go to the island. So again, I wouldn't not proceed with applying just because of COVID. If anything, I would even encourage students to apply now. There's no time that you would ever have the opportunity of sitting at home and doing, you know, completing completing a semester at home. That is unheard of. You know, it's not an online distance type of education. So. So I don't know if you have anything to add to that.
Yeah, so actually so I know Saba, my school, is offering online alternatives to certain rotations, as well as, you know, basic medical sciences. Obviously that's not applicable to all or even most of your rotations, but they're doing that so that it doesn't hinder the timeline of you graduating and matching, so that you still meet the requirements required to graduate. So, and I'm sure that Saba is not the only school doing that. Right. So, you know, again, and also just in the perspective of like a pre-med, I'm sure, actually, no, I do know that there are like virtual open houses, because usually they would be having these open houses in person, where you can find out more about the school before thinking about applying there. So, you know, there are still a lot of options. There's still a lot of ways for people to find out about the different medical schools in the Caribbean.
Sure. So, do you have any final words before we end today?
Yeah. You know, whatever it is that someone is thinking of doing, just, you know, just breathe, take a step back, try to collect all the information you can. And the fact that there are resources like MedmatchMD, take advantage of that. You know, take so much advantage of that, because if I'd had a resource like that, I think my decision would definitely have been a lot more informed. Yeah.
Awesome. Thank you so much, Dr. Chughtai, for taking this time to talk to me. Your advice and just the information you provided is fantastic. Students will definitely benefit from everything you've talked about. So thank you once again. I really appreciate you taking the time to, to sit with me and chat with me virtually about your experience. And for all of our listeners, thanks for taking the time to listen. Again, go to MedmatchMD.com and you can get started on searching and comparing close to 40 Caribbean medical schools. You can do this, side by side, and you can get to a decision on what school is right for you. So again, all the best in your application or process. Dr. Chughtai, all the best with your residency training. Thanks everyone for listening. Have a great day.